Hi, I'm Max Weisky, and I'm going to be playing the nurse in this scenario.
And I'm Bree Shearer, and I'm going to be playing the patient, Joanne Smith, in this scenario.
Alrighty, let's start.
Perfect.
Knock, knock. Hi, Joanne. How are we doing today?
Hi, I'm doing good. I'm really happy I get to get out of here today.
Wonderful. Well, I'm Max. I'm the charge nurse that's taking care of you today, and I'm here to prepare you to get out of here. And your doctor has a few things he wants me to go through with you, and a few questions I want to ask and screenings, and then you'll be on your way, okay?
Okay, sounds good.
So looking in your chart, I see that it says that your husband died 3 months ago. Do you have any family or friends that live with you or nearby that can help take care of you?
Yeah, he did pass 3 months ago, and it's been really tough, but I do have my son who lives a couple miles away, and he checks in on me almost every day.
Okay, that's wonderful because we want to make sure we're prioritizing your safety when it comes to your discharge.
Yeah.
Would you be comfortable, like, how far is he right now?
Well, he's at work right now. I asked him to come in, but he couldn't. But he did ask me to record this so that he can listen to it later, and then I can also listen to it again so I don't forget. So I'm just going to start that recording actually on my phone.
Okay, that's wonderful. We want to make sure that if you have a son like that who's able to help out with your care, that he's also knowledgeable in your treatment.
Yeah,
Um,
he's really great with helping with everything.
okay. Um, Before we start, do you feel like if you go home right now, is there anything that needs to change with your house and how it's set up? And with heart failure, we want to make sure that we're not exacerbating yourself. So making sure that if you have stairs, if you have a long, large house, things like that, that might tire you out quick. Does your house feel set up for something like that?
Yeah, well, actually, before my husband died, he was on hospice. And so we made the house really accessible and we made sure there was no stairs. We have a ramp to get to our front door. And we made sure there was nothing for him to trip on because we needed to make sure he could get around the house too.
Okay. Yeah, so there's no wires, there's no rugs that are just thrown around that might cause you to trip or anything like that.
No, I keep the house really clean and tidy and there's no rugs to trip on.
All right, perfect. Your doctor might be sending you home with oxygen. We're still waiting for that order to come in. And if so, we just want to make sure that we're keeping a nice, clean, uncluttered environment. And with oxygen, it is important that we're not getting it close to any open flames, keeping it around 6 feet away from any open flames. So do you smoke or
Okay.
anything like that?
I don't smoke and my fireplace is gas and my stovetop is also just electric. So I don't have any open flames in my house.
Okay, yeah. And just making sure we're maybe keeping it away from that fireplace. That sounds like that's like the biggest open flame that might be in your house. Um,
Okay.
Speaking of which, how is the climate control in your house? Is it normally staying at a nice steady temperature?
Yeah, I like to keep it about 72 all the time.
Okay. With heart failure, we want to make sure that we're keeping a nice, steady, pretty warm environment. Any extreme heats or extreme colds might make your heart have to work harder than it normally would have, and it could exacerbate some symptoms that we'll be talking about a little later. Is there
Okay,
any,
I like comfortable.
okay. Is there anyone that you can call in an emergency? Can you call your son? Is he typically available?
Yeah, my son always answers his phone, and if he doesn't for some reason, I call his wife, and she's really good too at coming in on and checking on me.
Fantastic. And do you normally do your own grocery shopping, all those kinds of things, the daily chores around the house?
Well, I do the daily chores around the house. I like to cook a lot, but my son, he's so nice, and he brings me my groceries every week, so I don't really leave the house much, besides to get my mail.
Wonderful. Okay. We'll talk about that a little bit later with your activities. Um,
Okay.
and regarding your diet, I see that your doctor ordered a low sodium diet. Have you ever heard of a low sodium diet before? I know that your doctor laid out an order for this, and I just want to make sure you know maybe something about it before I talk about it.
Well, the nurse told me a little bit about it when they told me I had to go on a low sodium diet, but I like to eat I like salt, and so I'm a little sad about it, but I'll try and eat less salt, but
Mhm.
yeah.
Okay. That's kind of what the gist of it is. When it comes to a low sodium diet, we're really going to avoid extra seasonings that involve salt. So if you're making a steak, if you're making some veggies, trying to use other seasonings that don't have salt in them is kind of what we're looking for. And I know that you said your son does your grocery shopping. And when he's purchasing items, just looking at those nutritional labels, making sure we're not getting things with a large amount of sodium. So making if we're getting soups, for example, making sure we're getting low sodium variety. And
Okay.
that's gonna overall we're trying to limit your sodium to around 2,000 milligrams a day. And so just a great way to keep track of that. is just looking at those nutritional labels and maybe if you want, keeping a little diary, making sure that we're keeping track of this as we go.
Okay. Okay.
Okay. And just a quick little guideline, 1 teaspoon of salt is equal to 2,300 grams of salt. So that's kind of what we're trying to monitor. So another way to think of it, if it's easier, is we're trying to do around 1 teaspoon of salt a day.
Oh, that little. Okay.
Yeah, that little. That's it's a big culture shock when it comes to low
Yeah.
sodium diets because
Yeah.
1 teaspoon is not a lot. So,
Mm-mm. Okay. Okay.
do you typically what does your diet typically consist of?
Well, I try and eat lots of veggies at every meal, and I really like fruits. So I try and have a balanced diet.
All right, perfect. Yep, fruits, veggies, that's what we're looking for. When it comes to cardiovascular health, what we're going to be looking for is something like the DASH diet. So DASH diet is high in grains, frozen fruits and vegetables, low fat dairy, low fats and sweets, some legumes, nuts, and some lean proteins like fish, eggs, and poultry. Um,
Mm.
does that sound like you could do something like that? I can send you home with some handouts about the
Yeah.
DASH diet.
Yeah. It sounds like I'll have to reduce my red meat intake, but I can do that. And if you send me those pamphlets, that would be helpful.
Yeah, red meats is we're trying to limit those kinds of things. So if you do want red meats, you can get a nice little thing of chicken.
Okay.
That's kind of what we're looking for with this DASH diet.
Okay.
Um, so can you tell me a little bit about kind of what I just went over when it comes to low sodium and what I just talked about?
Yeah, so you mentioned getting some more low sodium items, when my son's at the store, getting low sodium soups and then also not putting as much salt when I'm seasoning things and trying to keep it below, do you say 2000 milligrams a day?
Yeah, 2,000 milligrams or one
A
teaspoon.
teaspoon. Okay, so really making my foods bland, but I can do that. And then also eating lots of fruits and veggies and more chicken and
Mhm.
yeah.
Yeah, that's exactly what we're looking for. And there
Okay.
are a few additional foods we want to make sure we're monitoring with. And once again, this will be with the DASH diet. We'll exclude these.
Okay.
We're going to be avoiding some leafy greens like spinach and kale. That's going to have some medication interactions, especially with your warfarin.
Okay.
Um, and high sodium foods, this also goes against your heart failure diagnosis, and foods that are high in potassium. So this includes foods like bananas, potatoes, avocados. That's going to interact with some of your medications like your lisinopril and your potassium chloride tablets.
Oh, okay.
And this will all be sent home to you with your medication sheets, with your list of side effects and foods to make sure we're eating most of. That's going to kind of incorporate the DASH diet. Um,
Okay.
one last thing before we start talking about some activities. Do you drink any alcohol?
No, I don't really drink any alcohol.
Okay. Do you typically eat a lot of sweets and sugary foods?
I try not to. I just occasionally will have a pastry or something.
Okay. An occasional pastry is nothing to worry about. We just want to make sure that we are like monitoring our blood sugar. So do you know how to do that?
Yeah, I prick my finger lots of times every day.
Wonderful. Okay. So when it comes to your heart failure diagnosis, one thing to keep in mind is trying to get some activities going with your lifestyle and slowly incorporating these. So is there anything you like to do that is like a physical activity? A few things that are common are like gardening, walking, swimming, or even like stationary cycling. Those are all common things that are typically done.
Well, I don't do any of those, but I do walk to my mailbox every day. It's just
Okay.
down the street.
So when we're starting off with activities, for the first 2 weeks, we want to make sure that you're getting some good rest. You're not going to go out get your mailbox. So for the first 2 weeks, we're going to have your son go ahead and do that. But we want to make sure that we're slowly progressing you in physical activities. So just making sure we're monitoring your heart rate is big when it comes to this. So do you have any method of measuring your heart rate, or have you ever heard of taking your heart rate with your wrist?
Yeah, well, my son actually got me this watch and it tells me when my heart rate gets too high and also I can check my heart rate anytime on it. It's pretty dandy.
Perfect. So your provider is going to send you home with your baseline heart rate. This is just going to be the heart rate that is most average for you. And when we're doing activities, we want to monitor to make sure you're not going 20 beats per minute over that baseline heart rate. So along with that, we want to make sure that if you experience fatigue and you feel super tired or like you're struggling to breathe, just making sure we're stopping what we're doing, sitting down if you can, and just giving yourself frequent breaks. With heart
Okay.
failure, it's very common to see that activities you can normally do without any issue have become a lot harder. So if you can normally walk from, let's say, your living room to your kitchen, while it normally feels like nothing with heart failure, it might be a little bit more difficult than you're used to. So frequent breaks is a huge thing when it comes to managing this.
Okay. Okay. So I'll just keep checking my watch if I start to feel out of breath. And if it's 20 beats per minute over my baseline, then I need to take a little rest and let it slow down.
Yes, that's
Right.
correct.
Okay. Okay.
Um, and one great thing we've seen that's very successful with heart failure patients is cardiac rehabilitation programs. The biggest hurdles when it comes to these are either time management or financial burden. So, do you typically have a lot of free time, and do you think you'd be able to afford a cardiac rehabilitation program?
Well, I'm retired, so I have all the time in the world, but I am a little financially strained sometimes, and so that might be a little bit of an issue for me if it's really expensive.
Okay. We can hook you up with a social worker before discharge, and she can kind of walk you through any financial assistance that you might qualify for, and making sure that if you can, getting you into some of these cardiac rehabilitation programs. They greatly help with diet management and physical activity, and just making we're strengthening that heart. Um, One thing that is really hard with heart failure is that it is seen as a permanent diagnosis. Um, when you have what you have, which is biventricular heart failure, that's the permanent weakening of those lower chambers of your heart. So when it comes to managing this, that's what our diet is doing. That's what these physical activities are for, and that's what your medications are trying to treat. So you're going to be with these on a long term. That's why these rehabilitation programs are great. Some other successful interventions I've seen is pill management, so little pill boxes to make sure we're monitoring the pills that you need to have each morning and night.
Oh yeah,
Um,
that's what I do right now.
oh, and that's perfect. So we're going to keep doing that
Okay.
because that's exactly what we want because you are on a few medications. So
Okay.
let's just quickly go over these real quick. You're aware of your aspirin. We're still going to be taking that. This is
Okay.
going to be to thin your blood and prevent clots. We noticed that with your EKG, when you came in today, you had atrial fibrillation,
Mm.
and your aspirin and the warfarin that you're also taking, that's going to help thin your blood and prevent clots, which is a high risk when it comes to atrial fibrillation.
Okay, yeah, we don't want that.
Yeah. With these medications, you're at a high risk of bleeding. So if you even experience a small cut or a scrape, like a paper cut even, just making sure we're monitoring that, we're making sure that it stops. And if it continues to bleed, making sure that we're calling 911 because that can be life-threatening. And we want to keep you safe.
Oh, okay.
You're also on carvedilol. This is to manage your blood pressure. Um, and what you will see with this medication is that when you're standing up, you might experience some vertigo and dizziness. So with your carvedilol, we want to make sure that when you're standing up slowly and you're supported. So when you're standing up, keeping your hands down on whatever you're getting up off of, grabbing a railing, grabbing whatever around you that's stable, and standing up slowly and smoothly. And even after you're standing up, standing still for 10 to 15 seconds, making sure that you're not dizzy, you don't feel like passing out, and making sure that you're not going to fall over. Okay?
Okay.
So with your lisinopril, this is for your blood pressure management. So one thing to look out for when it comes to lisinopril and your oh, torsemide is you are going to have an increased frequency of urination. This is to manage that shortness of breath you're experiencing when you're coming in. That was due to fluid in your lungs, and your swollen legs was also excess fluid. So these two medications are used to flush that fluid out of you, and it's flushed through urinating. So you are going to experience increased urination. And one thing just to manage with that is dietary changes that comes with the avoiding high potassium foods, as well as being just near a bathroom, making sure that you might experience frequent urination and it might come in a much more quick episodes that you're used to. So if you need to go, making sure that you're close to one.
Okay.
All right. Your next medication is ezetimibe. This is to reduce your cholesterol, and we just want to make sure that your common side effects with this medication are muscle and stomach pain and diarrhea. We want to make sure that you're going to be taking this with food just to manage those symptoms.
Okay.
You're taking hydralazine, which is also to lower your blood pressure. And once again, just making sure we're doing those slow position changes. Um, Once again, if this sounds overwhelming, we're sending you home with the medication sheet, but we're just about done.
Okay.
We already went over your torsemide. We're giving you potassium chloride. This is to replace some of the potassium you're going to be losing with that frequent urination. Um, and we're going to make sure we're taking this with food. We already went over your warfarin, and we already mentioned your glypyride. This is to control your blood sugar.
Okay.
So I know you already have been taking these medications beforehand. Could you just kind of talk me back why you're taking these medications and what they are?
Yeah, well, I've been taking the aspirin for a long time for my blood thinner, and so I'm used to that one. And then the glyburide also I've been taking for my type 2 diabetes. The other ones I'll just put in my pill box for what to take each day, and I'll follow the instructions you send me. But you said to change positions slowly so I don't pass out, and then I also need to stay away from bananas. And I'm gonna probably have to pee a lot more, so making sure I'm staying close to a bathroom. And then also if I cut myself or get bruises, to really watch them because they can bleed a lot.
Mhm. That's exactly what we want to monitor for.
Okay.
So some symptoms that are a medical emergency that we want you to call 911 with is, as you just mentioned, excess bleeding, bleeding that's not stopping. You want to call 911 for that. If you
Okay.
experience severe chest pain that doesn't subside with rest, if you experience shortness of breath that doesn't subside with rest, if you have pink foamy like cough or mucus that's coming out of your mouth, um, you want to call 911, making sure we're monitoring that heart rate. And if you experience a rapid heart rate, calling 911. And with your atrial fibrillation, you are in an increased likelihood of what we call a PE and a stroke. So these are two disorders that are caused by blood clots. So a stroke, an acronym you may have heard of before, is FAST. We're going to be monitoring for one-sided weakness of your body, slurred words, and stroke-like symptoms. For your PE, that's that shortness of breath we're monitoring because a blood clot might go into your lungs. It might cause difficulty breathing. So these are two medical emergencies we want to keep in mind.
Okay.
Um, and do you have a way of keeping track of your weight? Because I see that your doctor ordered strict I's and O's.
Yeah, I have a scale in my bathroom and I usually weigh myself every morning. So I can write down the measurements every day.
Okay. Yeah. Yeah. When it comes to your weight, just making sure that you have just a little log that you can just keep track of your morning weights with.
Okay.
Um, so can you about tell me like some medical emergencies that you would call 911 for?
Well, like you said, if I am really short of breath and sitting down and relaxing doesn't help, then I'll call 911 for that. And then if my chest hurts really bad, or if I have any of the stroke symptoms, like the facial drooping, the no, the pain on one side, then I can call 911 for that. Or if I start bleeding and it doesn't stop, then I can call 911.
Perfect. That's exactly what we want you to do. So quickly going over the test results we have for you today. The 12 lead EKG we did on you today, that was the one with all the sticky little stickers that went on you.
Oh
That's
yeah.
what detected your atrial fibrillation that we're managing with your blood clot medication, the aspirin and the warfarin. And we're also decreasing the workload of the heart with all those other medications. Your complete blood count was normal. Your basic metabolic panel showed that your sodium was low, which can happen with damaged heart tissues and fluid buildup. Um, you do show signs of kidney failure, so we're going to be managing that with your follow-up appointments and just keeping that in mind when we're doing these panels. That's also going to be treated with your heart medications because that was caused by your heart. So you'll just be seeing that when you come up with our follow-up appointments.
Okay.
And your cardiac labs showed your biventricular heart failure. Those were the two lower chambers of your heart that were damaged. Um, so the medications you're taking are going to help monitor for that and making sure we're managing that. And also, you might have a follow-up appointment where you might have a ventricular assistive device placed in. Um, that's just so if the chambers of your heart, if they're not pushing enough blood into your body, we input a device that basically contracts your heart for you and pumps for you, and it allows you to just be able to move on with daily life, and your heart is working as it should. So can you kind of walk me through what I just kind of talked about a little bit, like what you understand of heart failure?
Well, some of those labs are kind of confusing, but I think for the most part, I have atrial fibrillation and my heart failure is not going to go away, but we're managing it with medications. And then you mentioned something about possibly some damage to my kidneys, but my doctor's going to work on managing that
Mhm.
and follow-up care. And some of my medications are for that too. And I guess we'll just keep monitoring my heart failure and I'll do everything I can to make it not get worse.
Yeah. Precisely. One thing we really want to make sure you understand is how heart failure is a chronic condition. So this is considered permanent. You are going to be taking these medications long term. We want to make sure we're managing symptoms that comes with it and your medications. So making sure we're keeping up with that diet, those fluid restrictions, medication regimen, and those daily activities.
Okay.
So for now, our current goals are to make sure you're taking your medication as prescribed.
Mm.
Once again, I'm sending you home with the medication sheet that has all your medications, how much you should be taking, when, and common side effects. So making sure we're taking those as prescribed, um, and aware of common side effects. Um, and we're also sending you home with a list of most of the information I just went over today, and you're obviously recording it for your son, which is fantastic. Um,
Oh,
what are some of your goals when you're going home, keeping all this in mind?
yeah. Well, like you said, managing all my medications is going to be a big one. So I'll have my son help me with putting my pills in my pill boxes and taking those every day. And then another goal is going to be eating less sodium. And I think maybe my exercise to manage my heart failure. I'll try and exercise.
Yep, that's perfect. So, was there anything today that we went over that doesn't really make sense?
Um, well, we went over a lot, but I think if you send me all of the things that you said and medications and stuff, then I think I'll be able to manage it.
Yeah, it is a lot, and that's why we're sending you home with all of that. And as you were mentioning with like the diet, biggest thing to keep in mind is we're just trying to go for a teaspoon. Teaspoon is all day. We don't want to have any more than that. So that can be the most difficult aspect of this to manage, dietary restrictions. And once again, yeah, making sure we're managing the medication with the pill box, working with that with your son. That's precisely what we want.
Okay.
Um, So your follow-up appointment is going to be scheduled with your provider. You're going to be coming in and we're going to be just doing a follow-up with how you're managing your symptoms. You'll likely expect another metabolic panel just to making sure we're managing all of those medications that we're taking. And the diet also has to do with that metabolic panel.
Okay.
Um, and yeah, we're just about done. Do you have any questions for me?
I don't I don't think so. But if I have any questions, who can I call?
So at the bottom of each of the pamphlets we're sending over to your email, it has your provider's email and number where you can call if you have any questions. I can also just tell you if you want your recording will hear it, johnsmith@gmail.com, or you can call in at 503-888-7878. And that's where you can call if you have any questions regarding your care. Um,
Okay.
any last minute concerns that you have before going home today?
I don't think so. I'm ready to get home.
Alrighty, Joanne, we'll have a lovely day and we'll see you with your
Max.
follow-up appointments.
Okay, thank you.
Alrighty.
All right. Bye.
Bye.